right, so why don't we get started? Today we're going to talk about supplements and which is the right one for me. There are so many supplements out there, so we wanted to try to narrow it down to a few options, and today we're going to talk about what we carry in the office. I do just want to ask if you have any questions. We are going to address them all at the end. If we run out of time, we will reach out to you via email and we'll surely get back to you. Just please use the Q&A tab to ask any of your questions and we'll answer them at the end. So I'm going to be here for the next couple of Wednesdays around lunchtime to discuss different topics over the next few weeks, 12:30 every Wednesday for at least the month of February. This is our agenda for today. So we're going to talk about some of the updates in the office. We'll give a quick background on female pattern hair loss, an overview of vitamins and supplements, and then we'll compare them and have time for questions at the end. And again, if anyone joined late, just reminder to use the Q&A tab at the end for questions, and we'll try to get to all of them. If not, we will answer all questions via email. So my name is Sarah. I've been a nurse for 10 years and a nurse practitioner for about 5 years now. I got my nurse practitioner degree in 2016, and I have 5 years of experience doing aesthetics, injectables, and PRP hair restoration. So quick office update, our office all are open. We do have enhanced safety protocols in place. We have pretty extensive screening for all our staff and patients, including temperature checks. Masks are required at all times. We have pretty aggressive sanitation protocols between treatments and appointments. We are limiting our number of appointments each day and staggering the times to limit kind of foot traffic in the office. And there are air purifiers in every room. If for some reason you're still uncomfortable to come into the office and trying to limit exposure, we highly encourage you to get on the phone or video consult with one of the nurse practitioners or nurses here. And we're happy to continue treatment over the phone or via Zoom. We are shipping products just to make sure treatments continue as they should. And our Medi Tresse online store is available on our website. So this is just a disclaimer. I'll read quickly. The content contained herein is for education only and should not be considered medical advice. Medical advice may only be given through a one-on-one private consult that we'd have you come in and see one of the nurse practitioners with an appropriate licensed medical provider. So today we're going to be talking about some at-home treatments that are available for purchase. We don't recommend purchasing any hair loss treatment without first being evaluated by one of us. You know, we specialize in this and we want to make sure we're giving you the correct treatment. We also need to ensure that we have the correct diagnosis before offering certain treatments. So we're going to talk a little bit about female hair loss. First, we'll talk about the hair cycle and then types of hair loss and then how to treat female hair loss. So this diagram shows the 3 phases of the normal hair life cycle. So the anagen phase is known as the growth phase. This can last anywhere from 2 to 6 years. It's listed as number 1 there. In this phase, the hair is receiving all the nutrients it needs, it's actively growing. And one treatment goal that we focus on is to prolong or preserve this phase. The second is the Catagen phase. This is known as the transition phase. It can last anywhere from 2 to 3 weeks. Essentially, no further growth is happening here. The Telogen phase is known as the resting phase, and this can last anywhere from 3 to 4 months. So this is the actual shedding phase, and then a new hair will grow once this phase goes through. Over time, because of genetics, it's possible for this hair life cycle to shorten. So there are different types of hair loss in women and we treat them differently. So any under the umbrella of non-scarring alopecias are the androgenic alopecia, which is female pattern hair loss. It's inherited genetically. It's the most common type of female hair loss that we see. Telogen effluvium is an excessive shedding without a lot of regrowth. People can go through periods of shedding due to various factors. Traction alopecia can be from hair styling, tight braids, pulling on the hair follicles themselves. And then alopecia areata is spotty bald spots that come and go. They kind of wax and wane. Now, under the scarring alopecia umbrella, including frontal fibrosing, CCCA, and LP, these are more difficult to treat because the hair follicle actually gets damaged. And then we do also treat hair loss as a result of cancer therapy or chemotherapy. The time frame that the hair follicle stays in each of these phases will kind of determine how much shedding is occurring and how much regrowth can occur. So again, having an evaluation will be the best way to determine what's actually going on. So treating female hair loss, when you come into the clinic to be evaluated by one of the nurses or NPs, the first step is to determine what is the cause of the hair loss. So we do a thorough medical history, hair loss history, we do a physical exam. Trichoscopy is our magnifying device where we look at your scalp and see exactly what's kind of going on with the hair follicles. And that can give us pretty accurate ideas of what's going on. We also look for, if you have copies of your blood work, or we order blood work, just to make sure that you're nutritionally in good shape and see if there's any underlying deficiencies that can be corrected. And then biopsies we do in the office if there's anything concerning that looks like a scarring alopecia, or to rule out any scarring alopecias, we do biopsies here in the office. So the treatment can vary greatly depending on which type of hair loss work is going on. So today we're going to look at some of the underlying diseases or disorders that particularly with female pattern hair loss, and ways to treat them at home. So we're going to be talking about vitamins and supplements at home. So there's tons of supplements out there, and we often get questions about which one works the best, which one's the right one for me. So we're going to talk about the 3 that we carry in the office. So we have it narrowed down to 3, and we'll compare these 3. So we'll talk about the Tresse line, Viviscal, and Nutrafol, and other vitamins that are important for hair health. And at the end, we will compare all of these. So this is just an overview on vitamins. You know, when people think of supplements, they often focus on things that are found in the diet. Obviously, diet is very important to any piece of a hair loss supplement, but supplements also include other items that food can't really necessarily treat, including stress and inflammation and gut health. You know, these can also help with issues surrounding hair loss due to genetics and scalp and follicle health. Supplements can help to increase the absorption of these vitamins that you're getting in your food as well. So we'll discuss all of this. So dietary factors. You know, your diet and nutrition play a role in the overall health of your hair. Eating a healthy diet will help improve your hair in general. Many of the nutrients and vitamins that are important for your hair are also needed for other parts of your body. So if you're deficient in any of these vitamins, the body kind of allocates them to your vital organs, and then your hair will essentially pay the price of that. The nutrients and vitamins that play a crucial role in the production of hair in the body, and then being deficient in one or more of these nutrients can not only lead to breakage and less volume, but potentially even lead to hair loss. So the bulb at the end, at the base of the hair, contains the fastest dividing cells in the body. Just underneath the bulb is the dermal papilla, where blood vessels are located, and these blood vessels bring nutrients to the hair follicle cells. The nutrition is important to provide these hair follicle cells with the nutrients they need to maintain and produce healthy hair. So big important vitamins and nutrients for hair health include biotin, copper, zinc, vitamin A, vitamin C, vitamin E, and we're going to talk about a few more of these as well. So what role does stress have in hair loss? When stress levels are constantly high, or you have a stressful event, this can cause kind of a shock to your system. In terms of your hair, this can actually cause an unusually high number of hairs to move to the telogen, that resting phase that I talked about a few slides back. This increased type of shedding is known as telogen effluvium, and it's pretty common in women. So people go through periods of a telogen effluvium during times of stress. They can kind of come and go. Key vitamins and nutrients for hair health include ashwagandha root, resveratrol, and vitamin B6. These really just kind of help keep those hairs that you have healthy. So in terms of the inflammatory response, even though it's an important function for your body, when you have chronic inflammation, it actually damages healthy cells and tissues, including your hair follicles. So this picture here of normal skin versus psoriasis, this inflammatory processes like psoriasis kind of actually block hair follicles and damage those healthy cells and tissues where you don't have a great environment for hair growth to happen. So nutrients that have anti-inflammatory properties can help to open the hair follicle and promote healthy hair growth. Key vitamins here to help decrease inflammation include L-glutamine, turmeric, aloe vera, spirulina, and piperine. So genetics is a pretty big factor that affects hair. Androgenic alopecia is commonly referred to as female pattern hair loss, but it's one of the leading causes for hair loss in both men and women. DHT is the byproduct of testosterone, and this is thought to be the culprit of the genetic disorder or issue. So finasteride or Propecia is formulated to combat this, to essentially block DHT. It can be used in pill form or topically. We don't typically recommend this for anyone who hasn't gone through menopause, there are a lot of natural DHT blockers out there. Saw palmetto is considered a natural DHT blocker, which is in a lot of hair supplements. So next, scalp and follicle health. Healthy hair needs a healthy environment to grow. So your scalp, keeping your scalp healthy and clean is extremely important. Nutrients that kind of play a role in the protein synthesis to improve blood flow and healthy cell growth are important here. Key vitamins and nutrients for hair and a healthy scalp include biotin, folic acid, magnesium, niacin, vitamin E, and zinc. So what supplement lines do we recommend? There's so many supplements out there, so we're going to just narrow it down to the 3 that we carry in the office. So that's the Tresse RX, Viviscal Pro, and Nutrafol. So this is our Tresse RX Healthy Inside Plan. Last week we talked in detail about our Tresse RX line, the webinar last Wednesday. That webinar is up on our website if you did miss it last week, but I'll give another quick overview. So this is a 3-step program that kind of is formulated to address the total body inflammation through gut health and nutritional factors that kind of affect hair growth and shedding. So the Tresse Prebiotic is a prebiotic supplement, and this is what we felt was missing from other supplements. This is a powder. It has a mineral-rich blue-green algae. That's what gives it its bluish color. It has proven anti-inflammatory botanicals, curcumin, aloe, licorice, and beta-glucan. This addresses gut health in powdered form. The Fortifier is the hair loss supplement. It's the follicle enrichment supplement. So this is a blend of botanicals, adaptogens, marine collagen, saw palmetto. Like I had mentioned in the last slide, that help prevent the blocking of the conversion of testosterone to DHT, which is known to break down the hair follicle. The Fortifier helps support hair growth. It has vitamin E, C, calcium, phosphorus, iodine, magnesium, copper, zinc, ashwagandha, resveratrol, inosol, choline, horsetail herb powder, L-lysine, L-cysteine, and HCl. The Revitalizer is our healthy hair supplement. So this has a premier blend of B vitamins in their most bioavailable form, which means they're rapidly absorbed. This has thiamine, B vitamins, niacin, folic acid, biotin, and panthoic acid. The way this line works is you'd want to start with the prebiotic for 2 weeks, a scoop once a day mixed in water, almond milk. And then after the 2 weeks of being on the powder, you would start the Fortifier and Revitalizer. The Fortifier is 2 pills a day along with the Revitalizer. So it's a total of 4 pills in the for the whole day. After the 2 weeks on the prebiotic, you'd then want to do the prebiotic every other day just to maintain gut health. And these can be used all together, or if you are preferring to do one over the other, you can mix it as one treatment, all treatments, to whatever works, whatever you're kind of looking for, whatever the problem is. So pros of the Tresse line, it's very comprehensive. We can customize it. Like I said, you can take 1, 2, or all 3. It's very sweet tasting, the probiotic, so it's super easy to drink. You just mix it in a little bit of water or almond milk, whatever tastes better for you. It's really, really not, it's a very sweet tasting, pretty delicious powder. It's gluten-free, and it's once a day for the dosing on that. The downfalls of the Fortifier and Revitalizer are the tablets are pretty large. They're capsules, so they can't be, they're tablets, I'm sorry, not capsules, so they can't be opened and mixed in anything, and they're not vegan. It does not contain vitamin D, which is really the only thing missing in this supplement. Otherwise, it is comprehensive in the sense that it has everything for hair health that you could need. Each of the key ingredients in the product have been studied and proven to be effective. So this is Viviscal. So there's 2 different strengths to Viviscal, extra strength and then professional strength. We carry the professional strength in the office. So just quickly, the extra strength, it has an exclusive marine complex aminomar that's kind of specific to Viviscal. It has biotin, zinc, vitamin C, horsetail extract, and iron. Good things about Viviscal, it's gluten, dairy, soy, nut, and egg-free. Cons are that it contains shark cartilage and oyster extract. So it is not vegan, and it cannot be taken if someone has a shellfish allergy. This is taken twice a day. It's a tablet versus a capsule, and it is fishy tasting. So those are kind of the cons. It does contain iron, which is good for premenopausal women. We recommend iron to any woman really prior to menopause. And clinical studies done in 2014 have showed a 2% increase in terminal hairs after 3 months, but not really a statistically significant change in hair diameter. So this is basically the watered down version of the professional strength. It's not as effective as the professional strength, which we'll talk about next. So this is the professional strength, and this is what we carry here in the office. So it contains vitamin C, biotin, calcium, and aminomar. So aminomar is the blend that's specific to Viviscal. This version, the professional strength, has more aminomar than the extra strength version. Fruit extracts, L-cysteine and L-methadine. It contains a higher dose of nutrient marine complex of the aminomar that I just mentioned, plus additional ingredients like apple extract, L-cysteine, and methadine, higher in dosage compared to the extra strength. So pros of this, it's proven to be more effective than the extra strength. Same thing with the extra strength that we just talked about. It is not vegan, and it cannot be used if someone has a shellfish allergy. It's taken twice a day. It's a tablet versus a capsule, and it's also fishy tasting. This, really the only difference between the two, was aside from this having a higher content of these vitamins and nutrients, it does not contain iron like the extra strength dose does. However, clinical studies have showed, similarly in 2014, about 57% increase in the in hairs have been proven. So it's clinically been proven to be more effective than the extra strength. And this is what we carry here in the office. So next up, we're going to talk about Nutrafol. Nutrafol offers 2 different hair supplements for women. So Nutrafol Women is for women anywhere from the ages of 18 to 44. And Women's Balance is formulated for women 45 and older, that has an additional hormone support in terms of menopause. So peri, pre, or during, and after menopause. It contains all of the ingredients of Nutrafol Women, but it also includes additional salt palmetto for hormonal support, maca and axanthin for hormonal support and oxidative stress. It's super comprehensive. So vitamins A, C, D3, biotin, iodine, zinc, selenium, maca, saw palmetto, marine collagen, ashwagandha, turmeric, vitamin E, xanthan, L-lysine, L-cysteine, which I've mentioned. Most of these are included in the prior Viviscal, like I had discussed, horsetail, resveratrol, black pepper, and capsium extract. So Nutrafol is very comprehensive. It treats a lot of different things. Kind of one of the big things is that it does treat inflammation and free radical damage, which Viviscal is not proven to treat, in addition to all these vitamins and minerals. So Viviscal is kind of lacking that stress piece in the sense of Nutrafol is able to treat inflammation and free radical damage. But every ingredient in Nutrafol has a purpose, and every ingredient has been backed by clinical research for their effectiveness. So pros of Nutrafol, it can be customized based on age. They've actually started to add additional supplements that you can add to your regimen to cover some of the important areas that Nutrafol had previously lacked. The good thing is Nutrafol is taken once a day, and the capsules can actually be opened and mixed in a food or a drink. The cons are it's the capsule size, so they're pretty large, but like I said, you can open them up and put them in your food or drink if that's easier to take. The taste is pretty unpleasant, and it doesn't contain B vitamins that some of the other supplements have, so that's really the big key there. It doesn't have those B vitamins. In 2018, there was an article that showed about 80% of patients had improvement at 6 months, and that included hair growth, strength, and thickness. And about 75% of patients saw visible reduction in shedding after 2 months of use. This is a little ingredient comparison. We're going to talk about the Tresse line in a second, but really Nutrafol and Tresse have anti-inflammatory properties that Viviscal does not. Otherwise, Nutrafol and the Tresse line super comprehensive, as you can see here. This is kind of a nice slide to incorporate everything that they kind of overlap with. Other vitamins and supplements. So those were the three that we carry in the office. The Tresse line, which is our line, Viviscal, and the Nutrafol. So even though there are other supplements that were part of like larger systems or more encompassing, there are some individual vitamins and supplements that we can recommend as well. So vitamin D is a common deficiency, and the dose is really specific to what your vitamin D level is, which is why we often check your labs prior to starting any treatments. If you had a severe deficiency, we could start with a prescription strength 5,000 IUs weekly, and then we would drop you down to over-the-counter dosing from there. Probiotics are important because they help maintain a healthy GI tract and help increase for better absorption. Fish oil is an important supplement. It helps to reduce inflammation. Iron, so iron is important in hair health. We look at your ferritin levels, which is essentially your iron stores. We like this number to be closer to 70 to 90 or higher, and that helps with hair. Sometimes that range is pretty wide, but 70 to 90 is where we like to see ferritin levels. Vitron C is a combination of iron and vitamin C. Vitamin C helps to absorb the iron better. This will help increase ferritin levels. Vitron C is over the counter too. So B12, also common deficiency, especially in patients who don't consume a lot of animal products. So people who might be vegan or vegetarian, and the dosage really depends on your B12 level that we would get from a lab draw. Usually we would recommend anywhere from 500 to 1,000 micrograms daily. So biotin, a lot of people have questioned us on what biotin does. Biotin alone doesn't really necessarily do much, but biotin does help make your hair thicker, but not longer or thicker. I'm sorry, it makes your hair healthier, but not longer or thicker. It is found in most hair supplements, but biotin really needs to be used in conjunction with other vitamins to actually have any real improvement or effect. So the doses range anywhere from 100 micrograms to 10,000 micrograms. The only thing with biotin is that biotin is known to interfere with thyroid testing. So if you were to have any blood work done, we recommend stopping anything that has biotin in it a week before your lab draw, and then you could resume it immediately after. So contraindications to supplements. Really, any woman who's pregnant or breastfeeding should not be on any of these supplements. Women with a history or a high risk of breast cancer shouldn't take supplements that contain saw palmetto, which is that natural DHT blocker. DHT, again, is the byproduct of testosterone. So we'd want to avoid the Fortifier and Nutrafol lines in people with a history or high risk for breast cancer. And then for patients with certain allergies, we need to pay special attention to the ingredients. Like I mentioned earlier, Viviscal shouldn't be taken with someone with a shellfish allergy. The big kind of topics here is that you should always meet with one of us or a medical professional who can review your history and help determine what supplement may be right for you. You know, this isn't very black and white. It's kind of a gray area. So it'd be good to talk to someone who specializes in these things before going ahead with a supplement. This is a little comparison chart. The first is our Tresse RX line. That's our 3-step series. That's going to be our #1 recommendation for hair supplements. Super comprehensive, customizable, so you can pick and choose if there's certain parts of it that you want to use or don't. It highly addresses dietary factors, stress, inflammatory factors, genetic factors, so it has those DHT blockers, and addresses scalp and follicle health. The Nutrafol would be our second recommendation. So it's moderately customizable in the sense that, you know, depending on age, there's 2 different formulas there. It does address dietary factors, stress, will address some inflammatory factors, and has natural DHT blocking agents as well. And also does address scalp and follicle health. Lastly, the Viviscal, it's really not customizable. It's just a one-stop shop. This is all you get based on this one kind of supplement. It has a moderate kind of addressing your dietary factors, not as great as the Tresse line does. It doesn't, you know, the downfalls of the Viviscal, it's lacking anything that kind of addresses stress, inflammation, and then doesn't have any DHT blocking agents, which we'd recommend unless there's a contraindication for you not to be on a DHT blocking agent. So kind of after, so the other thing is, you know, with anyone with androgenic alopecia or female pattern hair loss, we typically prefer them to be on a DHT blocker if it's appropriate. So we'd want to make sure that as long as it's safe for you, we get you on a DHT blocking agent. So really after some research at the end of 2019 and 2020, we kind of zeroed in on these products, and we felt the current supplements that options we had were missing the important role that the gut plays in hair health, hence our Tresse prebiotic. So, you know, that can be added on if you're already on Nutrafol or Viviscal and you feel like these are working for you. You can always add in the prebiotic from our line and just start it every other day, 1 scoop in some water, and that will help to just increase gut health and help absorption of all these vitamins. So the next slide talks about what to look for in a hair loss supplement. I like this diagram here. You know, female hair loss is very complex, and for many women, there's more than one factor that's causing their hair loss. So really, our supplement, the Tresse RX, and even Nutrafol to an extent, use this multi-therapy approach, and it focuses on all these potential factors. So really gives you the best chance to kind of regrow hair, decrease shedding, and overall rejuvenate your hair. So, you know, it looks at everything: genetics, stress, nutritional deficiencies, any hormone imbalances, scalp and follicle health, and the Tresse and Nutrafol lines all help to decrease shedding, promote thicker hair, stop loss, and actually help to regrow hair. So that is the end of the slides. We'll start with any questions. If, again, you could just put your questions in the Q&A tab, and we will do our best to answer all of them. We don't have any questions yet, so feel free to add any questions here. So Laurie just asked us, do we need to take the supplements with food? Yes, it's best to take with food just to avoid any stomach upset. You know, taking them all with lunch is usually fine, or any kind of snack is usually sufficient. We have a question here. Is the lab work to show deficiencies covered by insurance? Typically, it can be. You know, you can run that through your insurance company. We can give you prescriptions that you can take to any lab and have your labs drawn. But also, we could give you a list and you can go through your primary care to get the labs drawn as well. We have a question here. I had breast cancer, so should I avoid the DHT? Yes, we do recommend avoiding DHT blocking agents in anyone who has had a history of breast cancer or is high risk for breast cancer. What about a probiotic? So the probiotics are good, but the prebiotic really helps to kind of prime the GI tract, so you better absorb vitamins through prebiotics. So question here, Tresse supplements recommended to be taken forever or a period of time? Yes, essentially any of these hair treatments you do, you're going to want to essentially do for life. So hair, you know, treatments are something that you have to be really, really dedicated to. Hair results from any of treatments really take anywhere from 3 to 6 months to a full year to see their potential results. We have a question about Vegamore. So there's a lot of supplements out there that will pop up on ads, probably on your Instagrams and other things. We do know about all of these outside type of supplements, but these are the 3 that we have found to be the most effective and that we've studied here in the office, and particularly the Tresse line addressing the inflammation and gut health, and Nutrafol are the 2 best options we have found. I have a few questions here about consultation prices in Scarsdale. I'm not entirely sure. We can get back to you about that specifically. Here in Wellesley, our consultation fee is $150 to see the nurse or nurse practitioner. So we have a question here. Is it recommended to start the Tresse supplements prior to in-office treatment? We do, depending on which treatment you're talking about, with the PRP OPC injection treatments, we actually have you stop your supplements for a period of time before. So we would discuss that kind of based on what your treatment is individually. Another question is there the consult fee for a consult in Worcester, also $150. Yes, having a consult with the nurse in Worcester, it's also $150. If I have a Zoom consultation, can you still get recommendations for treatment? Yes, you can. If there's anything of concern though, we would recommend getting you in the office for a actual evaluation with our trichoscopy to make sure, take a good look at your scalp and make sure we're recommending the right treatment for you. The question here, do you recommend any shampoos or conditioners for fine or thinning hair? Last week on our webinar, we talked about our Tresse shampoo and conditioner. We have the volumizing shampoo and conditioner, which is great for this option. We also have the Trichomin line of shampoos that have copper peptides. They bind to the follicle of your hair and help give you the appearance of thicker, fuller hair. There are a couple questions here that I just would want to run by some of the other staff. I don't want to give you guys the wrong answers. So we're going to take your info and then we'll get back to you with answers for those. I think there's a couple questions here that I just want to run by. So if we don't get any more questions in the next few minutes, we'll go ahead and stop the webinar. But again, there's 3 or 4 questions here that we will answer individually and get back to you. So again, I'll be here next Wednesday talking about a different topic. And if you guys have any ideas for topics or things you're interested in, don't hesitate to reach out. And we look forward to talking to you soon. Thank you.